Hi, this is Humeral. At this video, we will discuss about what is rest off. Imagine you waking up and suddenly you cannot lift your wrist. Your hand hang down, your fingers feel weak, and also you have difficulty to gripping something. This condition is called rest off. And one of the most important structure to check is the radial nerve. What happens at the rest off? The radial nerve supplies the muscle which are responsible for extending your wrist, finger and thumb. If this nerve is compressed or injured, the extensor muscles are weak and paralyzed. And meanwhile, the wrist flexor can still fall down. The characteristic is drop rest. And why does it happen? Common cause include the prolonged pressure on the radial nerve while sleeping, also called the Saturday night palsy, the humeral shaft fracture, trauma, the improper crutches use, or other nerve compression. The exact symptoms depend on where along the radial nerve the injuries occur. The symptoms and examination of the wrist drop. The patient typically have difficulty to extend the wrist, finger and thumb. They cannot lift their wrist. There may be also have numbness, tingling over the back of the hand. Patient test rest, the extension of finger and thumb, brachioradial strength, sensation and reflex to localize the lesion. The main question is, can it recover? Here is the important part. Many compressive radial nerve can recover, especially when the nerve has not been cut or severely damaged. But the recovery is not instant. The nerve heals slowly, so the improvement may take weeks and into several months. It depends on the type of severity and injury. The physiotherapy can help to maintain the mobility and the hand function while the nerve recovers. The treatment may include a wrist extension splint, gently physio and active assisted movement, range of motion exercise, the progressive strengthening when the muscle activity returns, and the function hand training. Do not aggressively strengthen a completely paralyzed muscle, or do not repeatedly stretch the wrist into full flexion. But do not assume that every wrist drop is due to the nerve compression. If the weakness appears suddenly on the facial weakness, speech difficulty, severe headache and weakness elsewhere, seek the emergency medical care. And after a major trauma, open wound and suspected fracture, get the medical assessment promptly. So lastly, wrist drop is a sign, not a diagnosis. First, you should need to find the location and the cause of the nerve injury, then determine the treatment, okay? And follow for me for the evidence-based physiotherapy and clinical education.